I'm so excited about today's video, and I'm going to be sharing with you how you can move to the UK in 2 weeks as a healthcare worker. Hey guys, welcome back to my channel. My name is Fajira. If you're joining me for the very first time, I'm so happy to have you in my beautiful family. For my returning subscribers, I want to say thank you guys for always coming back to watch my videos. I really do appreciate. God bless you. If you're new to this channel, I create content on how you can migrate to the UK, jobs with visa sponsorship in the UK immigration updates, scholarships in the UK, like everything you can think about the UK, live in the UK. So if you're someone who is interested in such content, do hit on the subscribe button, turn on the notification bell, so each time I upload a new video, you're going to be the very first person to see that video. So guys, I'm really excited about today's video. Like we all know that the UK government has further extended the care worker visa, and I'm here to share with you on how you can migrate to the UK in 2 weeks as a care worker in the UK. I've seen a lot of people do it, not just one, not just two. A lot of my subscribers have relocated to the UK in 2 weeks as care workers. So if you want to know how you can migrate to the UK just in 2 weeks as a care worker, make sure you watch this video right to the end. Before I dive right into it, please do share this video with your friends. Give it a thumbs up so they can also follow this process to enable them relocate to the UK in 2 weeks as a care worker. So now the care worker visa allows you to come with your family to the UK to work and stay. So the government added the care workers to the shortage occupation list last year, February 15th, and it was meant to be reviewed this February 15th. But good news for us is that the government has further extended it to 2024. The UK government did not only extend it to 2024, also have approved £50 million to support recruiters, that's recruitment agencies, care homes, to be able to recruit overseas healthcare workers, overseas nurses, overseas carers, which is a very good news that the government has extended this to 2024, and at the same time has also made provision for funds so they can be able to recruit safely to the UK. Like I said, that in this video, I'm going to tell you how you can migrate to the UK as a care worker or as a healthcare worker in 2 weeks. Now, first thing you need to do, if you want to get a care job or a healthcare job in the UK, you need to get a job from a company that can sponsor you to the UK. That's a company that is approved to sponsor you to the UK, or an agency that is on the ethical recruitment list. I'm going to leave the ethical recruitment list in the description box below, and also the license sponsored list. So if you're applying to a care home, always check that the care home you're applying to is on the license sponsored list. And also, if you're going through an agency, ensure that they are on the ethical recruitment list, which I'm also going to leave in the description box below. So now I'm sharing this video to also encourage you and also to make you prepared as well this year, because I see a lot of you coming to the UK this year as healthcare workers, senior carers, nurses, care assistants, support workers, and carers. Like, I see a lot of you coming because last year I actually saw a lot of people coming. So you need to get a job in a care organization or through an agency that can sponsor you to the UK. So that's the first thing you need to do. So once you get the job, the next thing you have to do is for you to go and apply for your visa. Now, for you to apply for your visa, there are some documents you will need to have already. Remember that you don't need to start gathering these documents in 2 weeks. It's assumed you have these documents and you finally get this job, and you can actually move to the UK in 2 weeks as a carer. You will need your tuberculosis test certificate, you will need your police clearance, you will need your passport as well. Of course, you cannot travel without having your passport, and if you have any certificates you have done as a healthcare assistant, it's always good to have it to just support your application. It's not really mandatory, but it is good to have it to support your application. So now you will need that, and also you will need to have your driver's license, international driving license. Some care organizations will require you to have your international driver's license, but remember, it's not needed for your visa application, but it is good you just have it when you're applying for a job. Next thing you will need to have is your IELTS or NERIC, which is for your English proficiency. So if you have your BSc, then you don't need an IELTS, you will need NERIC. I will leave the link in the description box below, because this video, as I'm mentioning them, I'm going to leave the links in the description box below, so you can make use of those links to apply for whatever you need. So you will need your NERIC if you have a BSc, or you have a master's, you have a PhD. You do not need to have an IELTS. Just apply for your NERIC and you'll be able to get your certificate. You have to apply for your NERIC certificate through the X's link I'm going to leave in the description box below. If you do not have a BSc a first degree or anything to use for your NERIC application, that is when you will need an IELTS. So you will need to apply for your IELTS. I'm going to leave a link to where you can apply for your IELTS in the description box below to help you as well, so to make things very easy, especially now that the government have extended this to next year. So make use of this time to make sure that you get everything you know you need for this process. So you will need an IELTS. If you do not have a BSc, you do not have any degree, you will need to register for an IELTS. And the IELTS you will need to register for is a UKVI Academy or UKVI General. So once you have either of them, then you can now use it for your visa application, right? So I will leave the link, like I said, for the IELTS in the description box below, so you can make use of that. You will need to do some certificate courses. I mentioned Florence Academy a few months ago. Florence Academy used to be free, but right now Florence Academy is charging. There are other websites you can get some free courses like Reads. You can try Reads. You can see some healthcare courses for free. Try to make sure you do them. Then add all of this to your CV, so that when you apply for a job, the organization will know that you've got the experience and also you've got some certification as well, not just the experience. So it will be wise that you do those courses and put them on your CV to stand out. We know that this particular care job is competitive. In fact, last year it was very competitive. Even up until now, it's still competitive. So now that the government have extended it, it will be more competitive. So just make sure you stand out in everything you'll be doing regarding this process. So you will need a proof of funds of £1,270, which is supposed to be in your bank account for 28 days. So once you have that for 28 days, then you're good to go. Some of my subscribers that I've been in touch with, they've got this money saved in their bank account already, so that once they get a job, they will just go for their visa application. Yeah. Now, some people do not even have this money in their bank account. So when they get the job in first week of February, then they will have to put that money in their account till the first week or second week of March for them to be able to apply for their visa. But now there is a game changer. The game changer here is that some care organizations and some agencies usually tick the proof of funds. So now when you're applying for jobs, I'm not saying you should go and ask them before time. If you're lucky to get a care organization that will take the proof of funds that they will cover it, then you don't have to wait for that 28 days to show any proof of funds before you go for your visa application. So now once you get the job, let's say you get the job on a Monday, and by Wednesday you've been sent your course certificate. By Friday you're going for your visa application, and you're paying for priority service, and priority service is 5 working days. So let's use 2 weeks as I earlier mentioned. If you're able to secure a job, that's knowing that you have all of these documents and you have everything that is required for your visa application. But let's say you get a job on a Monday, and on a Tuesday or Wednesday, let's say Wednesday, you get your certificate of sponsorship. And once you get your certificate of sponsorship, on that same Wednesday, you can actually fill your visa form online, right? Then you go for your biometrics, let's say on a Thursday or Friday. Now, when you go for your biometrics, you pay for your priority service, you can now get your visa in 5 working days. But if you choose not to pay priority service, you could get it in 2 weeks, in 3 weeks. I've seen some people that actually did not pay for priority service and they got their visa in 4 working days, 5 working days without paying for priority service. But now if you pay for priority service, in 5 working days, you get your visa. And the next thing, you're coming to the UK to work as a care worker. Now, you didn't have to show your proof of funds because the company have ticked the maintenance box for you that they are going to cover that. So once a care organization ticks the maintenance box, the Home Office does not really care, because they know that the organization that has employed you are going to take care of you for that first month of your relocation. So they don't really care about that. If you're able to get a job in the organization that will take the maintenance box, you have all your documents at hand. Within 2 weeks, you should be in the UK. I've seen it happen. I had a session with a subscriber and she was like, she really wanted to be in UK in 2 weeks, and she made it. She got a job in a care organization, ticked the maintenance section for her, so she didn't have to show any proof of funds for she and her family, and she moved to the UK in 2 weeks. Now, another way is if you already have up to £1,270 in your account, just leave it, don't touch it. That's my advice. That's what I advise a lot of people, and it has worked for them. Leave it in your account. So once you're able to secure a job in the UK, just in case the care organization you secure the job with are not willing to tick the maintenance box, already you have your proof of funds in your account. then you can just go for your visa application without having to wait for another 28 days. So it's still the same thing with the first one I explained. If you get a job on a Monday, get your certificate of sponsorship on a Wednesday, on a Friday you're going for your visa, and your visa will be out the next week. So 2 weeks as well, you're here, even if the organization did not tick the maintenance box for you to say they are going to look after you for the first 1 month of your stay in the UK. So this is the easiest way on how you can move to the UK in 2 weeks. While you're making your preparation, if you have any money in your account, my advice is just leave it, because you don't know when you will get the job. Try your best to discipline yourself not to touch it. Just leave that amount. I think £1,270 is not up to ₦1,000,000 in naira. I don't know how much it will be in dollars. Just make sure that that money is in your account. And the good thing about the care worker, like, you know, you're not paying for health insurance, so that money for health insurance now, if you have it already somewhere, just add it as your proof of funds. And just in case you're lucky to get a job in a care organization that is willing to tick the maintenance box for you, then you go straight for your visa. Pay for your visa application. You don't really need a priority service for your visa, except you just want to pay for priority service, because a lot of visas now are being processed faster than what it used to be before. This is how you can move to the UK as a healthcare worker, as a care assistant, in just 2 weeks. Like I said, the 2 weeks, you have to make sure that you have all the documents. You have your tuberculosis, you have your police clearance, you have every document you will need for your visa application. You have your passport. Remember, if you haven't applied for a passport in any of the countries, you've applied for it now, because this process cannot be complete without your passport. Your course certificate cannot be issued to you without a valid passport. So do apply for your passport and follow up with the process. I'm just so grateful that the government have extended the care workers on the shortage occupation list, which is a very good thing. For another 12 months, try your best to make sure that you gather everything you know you can from now. Don't wait that, oh, tomorrow I want to get the job first, I want to do this. Just try and see how you can gather everything you want for this process to go smoothly, and start applying for jobs. While you're gathering those documents, be applying for jobs, be calling the care homes. One of the questions I've been getting recently after I uploaded the extension of the care worker visa is that, does the requirements remains the same from what it was? The answer is yes. Nothing has changed. The requirements is still the same. Everything you needed to apply for a job before now is still the same, but I would just advise that do some more certificate courses, get some more experience, review your CV, and send in more applications to more organizations. The government did not change anything. The only thing is that from April this year, the minimum wage will be increased. At the moment, the care workers are on £10.10, and in the proposal Mark made, they were proposing that the care workers should be paid £10.50 from April. So we don't know if that is going to happen. All I know is that the minimum wage will be increased from the 1st of April. We just hope that everything changes for our good, just like we've seen that the year has started very well. So guys, this is the best time to start getting everything you need and start applying to care organizations. So I would advise that if you need to do some courses that will take you up to the level of a senior carer, please feel free to do it. It's going to be for your own good, because the senior carer's role remains on the shortage occupation list. The government is not reviewing it. It has been there long time ago, and it's still going to remain. But for this one, this is just extended for another 1 year, which I strongly believe that it may remain on the shortage occupation list, just like the senior carers. But guys, use this time to try all your best, put in everything you know you can put in to make sure you find yourself in the UK as soon as possible. So this is a simple step on how to move to the UK in just 2 weeks, or maximum 6 weeks, just in case you don't have the proof of funds in your account. So guys, we've actually come to the end of this video, and I hope you find this video helpful. Do hit on the like, share this video with your friends and loved ones so they know that every document you still need for the care worker visa still remains the same. There's no other additional documents. So share with your family and friends and loved ones. Also like, so that YouTube will recommend it to other people as well. And if you're yet to subscribe to join our beautiful family, please do hit on the subscribe button, as I'll be sharing a lot of jobs with visa sponsorship. We are back to it again. I'll be sharing a lot of jobs by God's grace with visa sponsorship, so you have to stay tuned. So each time I share a new video, you're going to be the very first person to see that video jobs I'll be posting here before others start applying. So until I see you in my next video, guys, do take care and have a lovely day. Bye bye for now.